Hello, my name is Dr. Appel from Ado Psychology Center, where we specialize in treating anxiety, depression, and OCD. Welcome to our video seminar series. Hope you enjoy this video. This video is on social anxiety disorder. The goals for this video are to understand social anxiety disorder and learn about treatment. The diagnostic criteria for social anxiety disorder includes fear or anxiety of social situations where you're exposed to possible scrutiny by others. So, for example, eating, drinking, using the bathroom, performing in front of others, such as giving a speech. So, any type of activity that you do in front of others that potentially can expose you to scrutiny by them, and the social situations are avoided or endured with intense fear or anxiety. So, you're deciding to not eat or drink in front of other people. You're trouble using the bathroom when other people are in the public restroom. You're avoiding giving speeches at all costs. You're skipping class. You're not attending meetings where you'll have to give a speech or give a presentation. Or you're not avoiding all of this. You're engaging in these activities, but you're enduring it with a lot of fear and anxiety. So the core fear underlying social anxiety disorder can be summed up as the fear of negative evaluation, being afraid of what other people are thinking of you. Some common examples, in this order, by the way, at least for the first two, is speaking in public, very common example. Shy bladder syndrome, which is where someone, actually has trouble using the restroom and the mechanics of their body don't allow them to use the restroom while there are other people in the restroom. Parties, going to, parties, engaging in parties, speaking up, with friends at parties, going to the gym, using a gym, eating, friends. So let's get into more of the details for each of these now. Speaking in public, which is probably the most common form of social anxiety, is where you are so afraid of what people in the room are thinking of you that it kind of gets to you and you feel petrified before you go up. And maybe you're afraid your mind's going to go blank or that you'll start sweating and people will notice. In fact, if we give someone the diagnosis of social anxiety disorder, we're supposed to specify if it's this specific subtype because it's so common. Paruresis or shy bladder syndrome, like I mentioned before, the physical mechanics don't allow someone, like when they're so anxious about someone, thinking of them in some kind of way when they are in the restroom, that their body physically doesn't allow them to use the restroom. Parties, you're afraid of what people are thinking of you. You're afraid if you make a joke and it's not going to land. You're afraid of, people judging how you look or how you're dressed. Using the gym can be really triggering for someone with social anxiety disorder. People are perhaps looking at you and noticing that you don't know how to use the machine, or that you are using it for too long, or that you um, are not serious about working out. All these different things that people with social anxiety can think about as to what others are how others are evaluating them. Eating in front of other people are going to think I'm a messy eater. Spending time with friends, what do my friends think of me? Again, like I said before, I don't want to say a joke and it's not going to land. Or if I say this comment to my friends, they're going to think that I'm not sensitive to a certain group of people, whatever it might be. Because we are social creatures, you can imagine how debilitating this can become. Because we are all about connecting with others. And if we're always afraid of what people are thinking of us, it can really interfere in so many domains in a person's life. So let's talk about some statistics as they relate to social anxiety disorder. The 12-month prevalence in the US is 7%. So 7% of, individuals in the US have experienced social anxiety disorder in the past 12 months. Age of onset is around 8 to 15 years old, so pretty early on in life. It affects more females than males in the general population. but it affects more males than females in clinical settings. And one explanation I saw for this is that perhaps it's considered more culturally appropriate or less culturally appropriate for a male to, have social anxiety versus a female. So the male, they're like, this is not okay. This is like society is not allowing me to function when I'm so, socially anxious. So they have to go for treatment. Whereas females, perhaps it's more acceptable, so they don't even go to treatment. So in the general population, it affects more females than males, but in clinical settings, it's actually more males than females that come in with social anxiety disorder. And only 12% of shy individuals meet criteria for social anxiety disorder. So being shy does not necessarily mean that you meet criteria for social anxiety disorder. And what's the difference? So let's talk about that here. Shyness versus social anxiety disorder. Shyness is a common personality trait and is not by itself pathological. In fact, in some societies, shyness is even evaluated positively. However, when there's a significant functional impairment, or clinical distress, which just means that it's really distressing, it's very painful on an emotional level for the person, then social anxiety disorder, of course, should be diagnosed. So that's a big difference here. If it's your personality trait and that's just who you are, but it's not really impairing your life, it's not really bothering you much, maybe people even think it's something nice about you that, that you are that way, then it's not necessarily social anxiety disorder. But like I mentioned before, only a minority 12% of shy individuals in the US have symptoms that meet diagnostic criteria for social anxiety disorder. So most people that are shy do not have social anxiety disorder. Let's discuss now therapy options for social anxiety disorder. So we're going to discuss cognitive behavioral therapy, CBT, rational emotive behavior therapy, REBT, acceptance and commitment therapy, ACT, or a combination of all three. Let's begin with CBT therapy, cognitive behavioral therapy. So the basic CBT conceptualization, and definitely check out my video seminar on CBT more broadly for more specifics on this. But in general, it's what you think and do affects the way you feel. So let's apply the CBT model to this case of social anxiety disorder. So we have your thoughts, emotions, behaviors, bodily sensations, and they all interact with each other. And so in a case of social anxiety disorder, someone's probably thinking, like, my friends think I'm such a nerd. And so they don't feel great inside. Maybe they feel kind of anxious or sad. And so what behaviors do they engage in? Well, if everyone thinks I'm a nerd, I'm not going to speak up because I'm going to sound nerdy. And their physiological sensations in their body is probably feeling jittery or like a knot in their stomach. And when you're feeling that way in your stomach, then you're likely to have more thoughts of like, this is terrible, this is going so bad, no one like is talking to me, this is bad. And then you decide to even engage less with the conversation because you're so in your head now. So as you can see here from a CBT perspective, thoughts and behaviors and other behaviors are you might avoid social engagements. And what happens if you avoid them? They become harder and harder to start engaging in. So you can see here from a CBT perspective how your thoughts and your behaviors and your physiological sensations in your body really affect ultimately how you feel and how you behave and how you think. So to deal with the thought aspect, it begins with a thought record usually. A thought record is really just to help you gain insight as to what's going on. So after you experience some social anxiety triggering situation, take a moment and write down what was the situation first of all. So I was out with friends, eating lunch, and I, felt very socially anxious. What was your physiological response? Well, I felt like I had a knot in my stomach. What was your behavioral component? I shut down, I didn't speak. What was your cognitive component? I thought that everyone thought that I didn't have anything to share and that I'm stupid. Okay, so at least now we gain some more insight as to how social anxiety disorder really plays out in your life. So when it comes to skills to address it, we have cognitive restructuring skills, such as, restructuring the way you're thinking. So perhaps you're engaging in some cognitive distortions. And again, check out my other video to understand this in more detail on CBT more broadly. But in cognitive restructuring, we're trying to identify how are you misreading the situation or how are you experiencing unhelpful or inaccurate thoughts. And you're probably engaging in mind reading. and jumping to conclusions when it comes to social anxiety disorder. Like you are assuming you know what's going on in other people's minds and what they're thinking about you. Behavioral experiments and behavioral exposures. So behavioral experiments can be something like, let's put it to the test. You think that if you're going to the gym, everyone's going to be staring at you the whole time, and someone's probably going to like walk over to you and tell you don't belong here. Okay, well, let's test it out. Go to the gym once, have a friend come with you, let them document how many people are actually staring at you. Let's see if anyone actually tells you they don't belong there or not. So this can be a very powerful way to change your thinking when you're actually putting things to the test in a behavioral way. Then we also have exposures where if you're really afraid of going to the gym, you have to start going to the gym more. And the more you expose yourself to your feared triggers and fully engross yourself in the activity, then over time it becomes easier and easier. REBT, Rational Emotive Behavior Therapy. REBT in a nutshell. First, it was developed by Albert Ellis in the mid-1950s. It focuses on identifying and challenging irrational beliefs that lead to negative emotions and dysfunctional behaviors. So this sounds very similar to cognitive therapy or CBT like we just discussed. But over here we have the ABC model, which is the activating events are triggering beliefs, which is B, which lead to emotional consequences. So the goal here is to challenge the irrational beliefs that underlie the automatic thought. So the automatic thought might be some of my coworkers don't like me. So in CBT and cognitive behavioral therapy, what you would do here to restructure the thought is say, really, how do you know they don't like you? Did anyone tell you they don't like you? Are you sure they don't like you? Are there also coworkers that do like you? Whereas in REBT, we're not really changing that thought. We're trying to get at what's the underlying belief behind that thought. And that's what we're addressing. So if the thought is some of my coworkers don't like me, I might tell you, so what? And then you tell me, well, the underlying belief is that I need to be liked by all my coworkers. And then I'll tell you, says who. That's where we need to change it. So I'm not going to argue with you with the automatic thought. Let's say people at the gym are looking at you. But who says, and what's the big deal if people do look at you at the gym? So in traditional CBT, we might be dealing more with the negative automatic thoughts and say, well, are you sure that people are actually looking at you? In REBT, we're saying, let's assume they are looking at you, but so what? And that's why I call this the so what approach. Because instead of arguing with the automatic thought, we're taking it one step further, one step deeper, and saying, let's assume it was true even, but so what? Let's assume your friends do think you're kind of nerdy. So what? And when you take that approach, it helps you be bolder and live more in your body, live more as yourself, without being so concerned about what other people are thinking of you. Acceptance and commitment therapy, ACT. So for ACT, again, I recommend you check my seminar on ACT to learn more about ACT specifically. But the goal of ACT is to attain psychological flexibility so that you can live a life that's in line with your values. And so you figure out what are your values. And so in the case of social anxiety, your values might be like being a friendly person, you want to have friends. And so you need to engage in committed action. You actually have to hang out with your friends. Or your values might be to be a healthy person or, to be physically fit. So you have to go to the gym. So you have to hang out with your friends. You have to go to the gym. That's a given. Now you have these thoughts that are getting in the way. The thoughts are that everyone's looking at me at the gym when I'm by the gym. So then you have to engage in cognitive diffusion to deal with those thoughts. So you want to distance yourself from those thoughts, change your relationship to the thoughts to the point where the thought just becomes a thought and it's not something you actually have to deal with. So it's hard to explain it all on one slide, and therefore I do recommend you look at my seminar on the ACT model. But in short, you're kind of, one cognitive diffusion technique, for example, would be to say something like, I'm noticing my mind sending me the thought that everyone's going to look at me at the gym. Thank you, mind, for that thought. And then move on with your day. So you have your values, you have your committed action. That's really what your life's all about. If thoughts are not helpful, then just defuse from them, disengage from them. And same for emotions. I'm noticing this like pit in my stomach, and I still want to engage in my committed action here, and so it is what it is. You also want to have contact with the present moment. So in social anxiety, you might be like ruminating all day about a past incident. Instead, forget the past and live in the present. Or you might be concerned about a future situation, and the same thing applies. You want to live in the present. And self as context instead of self as content refers to the idea of you being able to observe your thoughts, observe your emotions without feeling so attached to them as if you're in a trance, but rather you could be more metacognitive and recognize all the things that are going on and still decide your path in life to live in line with your values. So, in short, the cognitive skills for social anxiety disorder can include CBT and cognitive restructuring. From an ACT perspective, you can do cognitive diffusion. So again, cognitive restructuring is changing the thought and seeing if it's accurate. Are people really looking at you at the gym, or are they more focused on themselves, for example? Cognitive diffusion says, don't even change the thought, but just don't engage with it. Don't engage with the thought. Instead, create distance between you and the thought. And you could say something like, thank you, mind, for the thought that people might be looking at me at the gym. Okay. And then from an REBT approach, we would say, so what? Let's say people are looking at you at the gym. Okay, so we're not diffusing from it, and we're not changing that thought. We're not saying that they're not looking at you. They are looking at you. So what? And this again can help you live a more bold life. Behavioral skills can include behavioral experiments, which is put it to the test, go to the gym, see what actually happens. I put it under behavioral skills because it's like a behavior that you're engaging in, but really it's more of a cognitive skill, proving to you that your feared outcome actually is not necessarily going to come true. And then exposure is actually going to the gym, even if it's uncomfortable, more and more to the point where you become used to it and you become less afraid of it and it becomes less triggering. And of course, as I always say, a therapist can definitely help you tailor treatment for your specific needs so that you are getting the best treatment. But keep in mind, the therapist can use one model, but they can also use multiple models. And that's my approach in general, is trying to use multiple models, multiple modalities of therapy to really tailor the treatment for what works for you. So for some people, more of a cognitive restructuring approach might be helpful. For others, it might be an REBT approach or an ACT approach. We have all these skills at our disposal. We don't have to limit ourselves to one specific modality. Hope you enjoyed this video seminar. To see a full list of our current videos as well as upcoming videos that we'll be posting soon, visit us at adopsychologycenter.com and sign up to be notified when we post new videos. Bye for now.